Hi, it's Kelly again. I am going to update you a little bit as to what's going on with me. I saw the doctor above the nurse practitioner that I had been seeing at Guthrie Robert Packard Hospital in Sayre, Pennsylvania last week, a week ago today or tomorrow, I can't remember. He feels that I have too many diagnoses going on related to my GI system. He thinks that they all tie in together and somehow they're related to each other, and there's one underlying issue that ties in together that explains everything. He agrees with the celiac disease diagnosis and that he feels I may still have gastroparesis of some sort, but the IBS and the other diagnosis he's not too sure about. He reviewed my chart. He said he reviewed my chart for about a half hour before my appointment, and his head was just spinning before he came into it. He said my liver enzymes, when they were doubling, they were the ones that could be related to my celiac disease, because I guess at the time my celiac disease, like I had stated in previous things, were elevated. He sent me to a Doppler ultrasound on my liver, kidney, stomach, which I had done just this past Friday. And we decided on a medication called Donatol for a month, and if that didn't help with the pain and nausea, that he would refer me to another doctor that would address the sludge in my bile duct, as that could also be a cause of pain and nausea on the upper right side, and then we would proceed from there if that didn't help. Now, that same day that I had the appointment, I had waited until about 4 o'clock, 4:30, to call the pharmacy to see what was going on, because I hadn't received a text or a phone call saying that my prescription was ready for me to pick up. So it turned out my insurance had refused to cover the prescription, which is no surprise because lately they're refusing to cover almost every prescription any doctor is calling in for me. And it's becoming very frustrating because I don't think insurance companies should have that much say in any patient's treatment. It should be between the doctor and the patient as to what their treatment is, not the insurance company. I don't think it's fair. Anyway, that's a whole nother topic. So the doctor ended up getting the insurance, between the doctor and the insurance company, they decided that I could try Lesvin SL. It goes under your tongue. It knocks me right out. I'm supposed to take it every 4 to 6 hours, and if I take it with my bedtime meds, which is Abilify and Remeron, I'm out within 10 to 15 minutes of taking it, unless I purposely try to fight it. As soon as it wears off, I wake up and I'm right back in pain. So I don't know if you really call that helping or not. I know it's not really a form of functioning because I'm just tired all the time, which is hard because it's basketball season for my son. And I'm missing the majority of his games, not just because of my pain, but now with the medication, I can't really drive. So my son's having a hard time understanding that, I'm missing games because I'm in pain. And now I'm missing games because I just can't drive. And it's a vicious cycle. And how do you explain to a teenager that, before I was missing games because it hurt, and now I'm missing games because I'm on a medication and I just can't drive. So life continues to have its, its plus and minuses because of that. I don't know if you can tell with the lighting, but all my other videos I've been kind of down, and not down, but no makeup or anything like that. And this one, let's see, I'm wearing makeup. I'm trying to do things to help me feel better about myself. I've been in pretty much of a depression since all of this started, and I'm not getting anywhere. So I've decided, I may not physically feel well, but I can look and feel pretty. I'm trying to build up a collection of halfway decent clothes, which is really hard being on nothing but disability. I have about a few dollars left over a month. If there's nothing pertinent that needs to be taken care of right away, such as bills, I'm lucky if I have $10, $15 left over. If my son doesn't need something right away, I might go to a clearance rack at Target or Walmart and find something for I got this shirt for $6. You know what I mean? So, I can't really buy jeans or, pants that have a normal waistline. Those with stomach issues, no. If you have stomach pain, anything with a restrictive waistline hurts your stomach that much more. But I'm finding ways to dress up the pants that I do have. You'd be surprised what the right top and a pair of shoes can do. I'm going through some things in my closet, and I'm finding shoes that I haven't worn in years, so it's working. I feel a little hopeful. The doctor said that if this medication that I'm on, the Lesfin, doesn't help, I have to sludge in the bile duct, and I may have to have surgery to have the sphincter widened to allow that sludge to come out. He's hoping that's the cause of the pain and nausea, so we'll see. A little hopeful here. So that's what's going on as of January, what's the date today? 11th, 2016. Happy New Year! I'll talk to you guys later. Bye.